Tuberculosis, the deadliest infectious disease in the human history. TB has been responsible for more than 1 billion deaths in the past 200 years. It's estimated that about 2 billion people in the world are infected with the Mycobacterium tuberculosis. As for Mongolia, the latest records show that there have been 4,421 cases that has been notified, and the most common type of people that were infected were males above the age 14 as of 2017, and the treatment certainty of these cases are up to 32%. Denmark has a population of about 5.7 million, and the cases that has been notified is 275 as of 2017, and the treatment coverage is up to 87%. Japan has a population of 127 million, and notified cases of 16,789 with treatment coverage of 87%. Cuba has a population of 11 million and notified cases of 739 with treatment coverage of 87%. Australia has a population of 24 million and notified cases of 1,441 with treatment coverage of 87%. TB is an airborne disease and it could infect through direct contact or breathing. After transmission, the bacterium grows in the lungs, which later affects kidneys, heart, and brain through the blood. Although TB in the airway passages are infectious, the TB in other organs of the body are not infectious. TB can also be transmitted through bovine-related dairy products. Symptoms include night sweats, fever, coughing blood and sputum through air passage, loss of appetite, and chest pain. 90 to 95% of people who are infected doesn't show symptoms of active TB and have dormant TB infections, and they develop over time as they grow older or are rejuvenated by other diseases such as AIDS and HIV. Tuberculosis treatment includes taking antibiotics for at least 6 months. If the patient does not take the complete course of treatment, the tuberculosis may become resistant to the antibiotics and become harder to treat. So it is important to take complete treatments. Make sure to take the necessary medication until there are no signs of any more infections. X-ray pictures of the chest area is used to test any bacterial infection in the lungs. If there are any side effects from the treatment, consult your physician immediately. Alcohol consumption is strictly prohibited during the treatment course. TB can be spread easily in areas that are overcrowded and in cold climate. Travelers who are traveling to other countries with high TB rate and have weak immunity system are more likely to get infected by TB, so avoid contact with people with active TB, cows, and keep sanitized. People infected and diagnosed with TB should not travel to any place and should be treated in medical facilities. To prevent from getting infected by tuberculosis is to avoid direct contact at places that has exposure of people with active tuberculosis, wear masks, use pasteurized dairy products, and get checked regularly at the hospital for tuberculin skin tests.